Good afternoon. Thank you for joining us today. I'm Senator Nan Orrock, District 36 here in Atlanta, representing the Tri-Cities and the City of Atlanta. And we have several of us presenting today. We are here to announce that we are united in calling for Wellstar Hospital Systems to take responsibility and be accountable for what they've left behind untended to here in the city of Atlanta and the surrounding counties when they shuttered 2 hospitals. We have, as of this moment, we have filed 2 complaints. We have filed a complaint with the against Wellstar Health Systems, and that complaint is being filed. We're charging them. We're seeking an investigation for Wellstar's actions and their impact on the black and brown communities in the surrounding area that they serve. Whether they have violated Title VI of the Civil Rights Act of 1964. That complaint is filed with the Office for Civil Rights at the United States Agency for Health and Human Services. The second complaint which we have filed is a complaint with the Internal Revenue Service, asking that Wellstar's actions and failure to comport with the requirements of the IRS to maintain your not-for-profit status, your 501c3. We feel that there's grave possibilities that Wellstar Hospital Systems has failed to comply with the requirements to maintain their 501c3 status. They enjoy exemption from taxes. We have asked the IRS to investigate the complaint that we filed, that it should be considered as to whether they are in good standing and whether or not their 501c3 should be withheld until they repair the damage that they've done. The Wellstar Health System is a recipient of federal funds. It's based in Marietta, and in 2022, as we all know, they closed both the Atlanta Medical Center and the Atlanta Medical Center South, and that closure has had a disparate impact on African Americans and other people of color. These 2 hospitals serve the largest populations of black patients of any of the 10 hospitals that it owned at the time. Wellstar should be held to account. Wellstar should be required to repair the damage it's caused to this long-established system of care for the individuals formerly served by these facilities and the medical practices associated with or dependent upon those facilities. The harm from this action of the closure of these 2 hospitals, they had acquired these 5 hospitals and 26 physician clinics in 2016 from Tenet Health. Upon closure, they imposed great harm, and that harm continues today as we speak to the communities who depended on AMC and AMC South for their health services. Wellstar's action deprives black and other minority patients of critical services formerly provided directly by AMC and Atlanta Medical Center South, and as well as the office-based physician services that the community has relied on for decades surrounding these 2 hospitals. Patients have lost access to a prime source of inpatient care, as well as to one of North Georgia's only 2 Level 1 trauma centers. Closing AMC South eliminated the only emergency room in Fulton County south of I-20. These are not small measures that were taken. These are not small impacts. And Wellstar Health Systems as an enterprise should be held accountable for these closures. The Atlanta Medical Center and Atlanta Medical Center South service area serves a population with proportionally more black and other minority residents than those of Wellstar's other 8 hospitals. There are 7 counties in the service area for these 2 hospitals. And none of the 7 counties has a majority white population, and some have much lower shares of white residents. The majority of the population in the service area is Black, Hispanic, or Asian, predominantly Black. Counties in the other WellStar service areas, except for Douglas, which is counted in 4 service areas, have populations above 50% white, most in the 60 to 80% range. Those hospitals remain open. Those hospitals remain open. The hospitals that have been closed are the ones serving the minority communities. And the statistics for these service areas that are covered, WellStar is required by IRS to conduct and publish every 3 years a needs assessment in the communities. They have failed to do that, and they failed to do that for either of these 2 hospitals. And they know, and their own statistics show, that the hospitals that chose to close were the ones that primarily served minority communities. And this closure of these hospitals destroys a significant ecosystem of health care for Black and other minority residents of their service area. When WellStar made its announcements that they were closing, it was hasty, it was not transparent, and it left the closure of AMC up here in Atlanta left already stressed Grady Health System as the sole level 1 trauma center treating the most serious injuries in the northern part of this great state of ours. The other ones are in Savannah, Augusta, and Macon. And it seemingly the company assumed that Grady Hospital would pick up many of its former hospital admissions. It's very commonly known, and abundant research demonstrates that Black communities and other communities of color experience worse health, lower life expectancy, and more preventable deaths and disabilities than their white counterparts. The research also shows the great importance of a usual source of care and services delivered by well-trusted and culturally competent providers to change these outcomes. That's who's been practicing medicine and delivering services in these 2 hospitals. Culturally competent, well-trusted providers. Many people have for decades sought the health care for themselves and their families. I've talked to women now who have to go to Austell to see a cardiologist and spend the better part of a day navigating traffic. That's the ones fortunate enough to have transportation. There's no question about the impact, the negative impact that has been experienced. And I will say to you, in closing, WellStar's had other options than closing the AMC facilities. They cited a loss of $114 million in FY 2022 at AMC and AMC South as its rationale for closing. But the company had other options that could have allowed it to continue serving the population without discrimination, because as an enterprise, WellStar reported net assets of $2.67 billion in FY 2021, up from $1.75 billion in 2020. Meanwhile, instead of maintaining and enhancing services in the minority community where it already owned hospitals and medical practices, WellStar has signed a letter of understanding with the Medical College of Georgia in Augusta that may result at unknown cost in WellStar's takeover of that hospital system and construction of a new hospital in Columbia County. Columbia County in 2022 was 71.3% white, in stark contrast to the AMC service areas. As it abandons a minority community, leaving it in far worse straits regarding health and access to care, there is some irony in WellStar's CEO's statement about their current plans with Augusta University Health, in bringing the Augusta Medical Health System together with the WellCare Health System, that they will put our strengths together. We would improve the health of the community, address social determinants of health, and expand access to quality care for all Georgians. We have proof that WellStar ignored the input of the advisory committees at these 2 hospitals. We'll present that to you, and that is all contained in the complaints. I'm going to make available to you an attachment that was included in the complaint that we filed with the Office for Civil Rights at the Health and Human Services. And this is a diversity comparison of the counties that AMC and AMC South serve in Clayton, DeKalb, Douglas, Fulton, Henry, Newton, and Rockdale, that shows where the concentration is of black and brown patients, and along with comparing to the other hospitals that they own in other areas. And it's a compelling case, and I will close by saying, before bringing on other speakers, that we have account after account of Wellstar's failure to consult with the mayors of East Point, with the mayor of Atlanta, with Grady Hospital System, who right there in the shadow of this closed hospital on Boulevard is being incredibly impacted with this flood of maternity patients who formerly were being served at the Atlanta Medical Center. I am the next person to speak is going to be our Fulton County Commission Chair of the Fulton County Commission, Rob Pitts. I'll ask him to come now. They have had extensive experience as the county is charged with delivering health services for our citizens. They're mightily impacted by this decision, and we welcome the leadership from Fulton County. Can you come forward, please? Thank you so much, Rob Pitts. This chart is available to you from our press folks in the back.
All right, good afternoon, everyone, and thank you so much, Senator Orrock, Senator Oliver, Representative Schofield, and others for joining us this afternoon. Again, I'm Rob Pitts. I chair the Board of Commissioners of Fulton County. And let me begin my remarks by restating something that Senator Orrock just said. Under the Constitution of the state of Georgia, it is Fulton County, counties, but Fulton County in particular, that is responsible for health and human services. Not the cities, it's Fulton County, and we take that responsibility very seriously. I'm joined by our County Manager, Richard Anderson, and Dr. Pamela Rochelle, our Chief Operating Officer in charge of Health and Human Services. Fulton County is home to approximately 1.2 million citizens, but in addition to the 1.2 million citizens, we serve approximately another million of students, workers, and visitors who come to our county on a daily basis. The closure of the two Wellstar hospitals in Central and South Fulton County over the last 8 months has had a tremendous negative impact on our residents, just to put it mildly. Now, around this time last year, Wellstar came to meet with me and our county manager and told us that they were facing some severe financial challenges with their East Point location. In fact, as Senator Orrock stated, they were losing annually in excess of $1 million throughout their system. But even as a nonprofit, I understood that they were making a business decision and that they had financial responsibilities and obligations that they had to see to. But at that time, we did not fully understand the impact and meaning of their possible actions. But later, after much research and further conversations with them, we began to see the rest of the story. In December, less than 6 months after closing the hospital in East Point, and barely a month after closing Atlanta Medical Center, in which had served that community for more than a century, Wellstar announced a new partnership with Augusta University Health System that would include, or could include, a new hospital in Columbia County. Now, what you may not know is that Columbia County is a community of about right at 160,000 people. That is 71% white. Columbia County has a median household income of almost $86,000. South Fulton County is a community of more than 200,000 that is more than 80% black. The median household income in East Point, home of the South Fulton Wellstar Hospital, is just $53,000. Now, please stop and think about that for a moment. Now, let's also remember this. Wellstar did not entirely leave Fulton County. They're still operating a hospital in Roswell, a city of approximately 90,000 people, that is Now, you probably can guess, 70% white, and a median household income of $111,000. And as we go down the list of WellStar locations, a clear pattern emerges. And as I say, even our native son, Ray Charles, can see this. That's
right.
how clear it is. And we've all heard the term in real estate about redlining. And we all know what that means. Well, ladies and gentlemen, I'm here to tell you today that what we're talking about is no more and no less than healthcare redlining on the part of WellStar. Healthcare redlining on the part of WellStar. It means that they've chosen where they will do business and not to do business based on the color of skin and the size of the bank accounts in the zip codes where they're located. But it goes even further. WellStar did not just close hospitals. Like bandits, they swept up everything that comes along with the hospital. The clinics, primary care doctors and specialists, cardiologists, those who treat diabetes, high blood pressure, you name it, packed them up and took them all away. They have literally created a healthcare desert in Central and South Fulton County. And they've done so in a way that appears to be intentionally affecting a community with the highest concentration of black and brown people. In talking with our community leaders and our focus groups, they're worried. They're scared to death. What will happen to them? Where will they go to see their specialists? There's no hospital beds Central and South Fulton County anymore, but when they need to see a specialist, and they're angry. I'm angry. And WellStar thought that they could get away with this scot-free, but it's not going to happen. We at Fulton County will not allow that to happen. Healthcare redlining will be stopped. That's why we're so pleased today to be joined by and with Senator Orrock, Representative Schofield, NAACP, Reverend Durley, and others to sign a document that Senator Orrock, these two documents that she referenced earlier. Because if WellStar is not concerned about what the community thinks, or what Fulton County thinks, or our cities, or our state, then perhaps they will be concerned about the full weight of the United States government thinks about their actions. And along with this, Fulton County is pursuing all other possible legal, financial, and community options, and will be sharing the outcomes in the coming weeks. So thanks to everyone that's here today and to the community. I want you to know that Fulton County is in this fight for the long haul. Thank you.
Sorry.
Good afternoon. I am State Representative Kim Schofield, District 30. I am Kim Schofield. I'm so angry right now, and I apologize. Serving District 63, parts of City of Atlanta, Fulton County, and I go down to the Tri-Cities as far as and keep going to Union City. I stand here before you as a black woman who lives with lupus. So understanding when you take away our right to have health care, what you say to us is that our lives do not matter and our health is insignificant. WellStar's lack of transparency and intentional actions to address the needs of people that look like me and others who just need to have preventive care and place the demands on Grady was not only unsettling, it was disrespectful. Failure to demonstrate the willingness of WellStar to be forthright showed their true motive to put profit over people and create what already exists, healthcare deserts. Let me be clear, WellStar had no authentic plan and apparent strategy for revitalizing AMC Downtown or East Point hospitals to meet the high needs and better serve our communities. Their response was lackluster. There were options that they chose not to consider. While I understand that hospitals are here and healthcare systems need to make money, when you put profits over people and then refuse to be transparent on how everything's done, and then you go and open other hospitals up in Augusta, make these side deals and keep hospitals open, and Roswell and other areas, is a blatant action for discrimination, and it won't be tolerated. Wellstar took their resources and left our community scared, left our people refusing to understand what they had, where their options lied. I get calls all the time asking the question, what are we supposed to do? Wellstar knew what they were doing when they took their resources, leaving without looking back, laughing all the way. It's disgusting, disrespectful, and I'm going to send a message with all of my colleagues that it will not be tolerated. Thank you, Senator Orrock, and to my colleagues to stand here, to continue not only to be the voice, but to let you know when you deliberately take an action that hurts the people that you vow to protect and represent, and make a red line. The evidence is clear. But for all the people who will never get a voice in front of this camera, we are committed to holding Wellstar accountable. You won't get away with this one. I now bring up Richard Rose from the NAACP.
Thank you. I'm Richard Rose, President of the NAACP. Glad to be with you today. What Wellstar has done is endanger the entire community. When there's a shortage of beds, it doesn't matter whether you're on Medicaid, Medicare, or private insurance. If there's a shortage of beds, there's a shortage of beds. We are one catastrophe away from medical catastrophe, one bus wreck, one pile up on 285, when all of us will be affected by these beds, these lack of beds. Comparison, city of Charleston, South Carolina, about 240,000 people, 5 level 1 trauma centers in one city versus Atlanta. Georgia is about the 8th largest state, but we're number 42 in healthcare. So this is a crisis beyond crises. This requires effort not only from Fulton County but from the state. Of the 2 objectives of oppression, deprivation and degradation, closing these hospitals fit right into deprivation. Yes. Take away the resources, take away the health resources. That's where we are. It's important on both of these issues, the Health and Human Services as well as the IRS, because they are requirements that hospitals must follow, as Senator Orrock briefly mentioned. There are 4 requirements: community health needs assessment, financial policy and emergency medical care policy, a limitation on charges, and billing collections. The community health needs assessment must take into account input from persons who represent the broad interests of the community served by the hospital facility. Absolutely not done. And this should take place every 3 years. And it should include those with special knowledge or expertise in public health. And this needs assessment must be made available to the public. We believe that the entire Wellstar system should be made to account for what has been done at the Atlanta facility as well as the East Point facility. And this is in no way to malign the dedicated health service providers at at any of these Wellstar facilities. This is not about rank and file people who come and give their heart and soul to the service of patients every day. But this is to malign the management of the Wellstar healthcare system as not being considerate of these communities, black and brown communities in particular. So NACP stands with Senator Orrock and against these efforts by Wellstar. We've spoken out against them before. We will continue to speak out against them. And again, I want to remind everybody, a shortage of hospital beds affects us all, not just those with insurance, with employer-based insurance. It affects all of us. We are one accident, one bus crash, one major catastrophe away from a healthcare catastrophe that affects the entire metropolitan Atlanta region. Thank you.
Some of you are wondering why am I sitting over there sweating so much. It's not because of the incident. We just finished unveiling the Zanona Clayton statue down, and I had 15 minutes to get here. And I said, I'm not going to drive, I'm going to walk. And at 81, you should learn not to walk that great distance and when to walk. But I want to thank Senator Nan Orrock and the others who are here. My name is Gerald Durley, former dean at Clark, former dean at the Morehouse School of Medicine, and one who started with Dr. King in 1959 and 1960. It's a constitutional right for everybody to have health care. But this is the same kind of challenges that we face. You've already heard from the persons earlier about all of the complaints that have been filed and why it's so necessary that we now make a stance and complain about a company that's saying that they're a nonprofit, but they're making a major profit. We thought that the concern might have just been inefficiency as far as managing the welfare and of the company, of the hospital. But what has happened is that many of these, they did not consult, as you've already heard. They did not consult the community. They did not concern those that were directly involved. So consequently, it came very quickly. We held a press conference before they closed, and several of the employees came over and said, we didn't even know. We heard it in the cafeteria that we were being closed. So we, I'm president of Concerned Black Clergy here in the city of Atlanta, we said we've got to get involved with this and get involved because they're going to close the hospitals anyway. But the question I raised as the last speaker is that you've heard all of the information. What I've learned in my lifetime is that how does the press interpret this and how do you get the message to what we've tried to tell you today, the atrocities that have been occurred? How do you take the facts that have been presented and present them in such a way that we find that kind of bringing people together? We used to say organize, strategize, and mobilize. And how do you take this information when it hits the press today? What will people be saying? It's a group of disgruntled people talking about black and brown communities, or this was a discretionary act by this hospital that has been detrimental to all of us. So I hope that when you leave here, I guess I'm given a charge, is that when you leave here that you'll take these particular messages and interpret them in such a way that as we build momentum to see how do we take this 10,000 people that Grady will have to absorb now, what is it that we're going to do, not only as a community, but what will Wellstar be? How will they be accountable for this? Can we challenge their status as a 501c3 and raise the kinds of issues? And it's going to be a lot of us working together, what we're saying up here and what you're saying out there to make a difference. So this is, for years we used to sing a song, I'm on the battlefield. We're not on the battlefield anymore. We're in the battle. There's a difference between being in the battle and on the battlefield. And this is an issue that is so pertinent that I've given my life to and others have given their life to, looking out for the least, the lost, the left behind. And if we don't say something now, this is just the beginning. America has gone into such a divisive mindset now, and hopefully this will be, and we thank you, Senator Orrock and Nan Orrock and others for bringing us together today. The community is already rising up right now against this. We realize that the hospitals have been closed. We understand where they're going into the white community. This has been going on for over 60 years, but what we're saying now is that how do we begin to make some kind of difference in taking up for the least, the lost, and the left behind. Thank you very much. And I did have some prepared remarks, but they said everything I was going to say.
Don't throw those away. They'll be part of the history. I want to thank everyone that has presented, and there are many who wished to be here and had conflicts today with last-minute notice. But there's the phalanx of concerned elected officials, leaders, community leaders, and ordinary citizens who well understand the negative impact of the actions that this corporation has taken. Never a fare thee well. Can you imagine making those decisions and not letting the mayor of Atlanta know, not consulting with Grady Hospital? You're a level 1 trauma center and you're walking out of this city? And we're supposed to find out by any means necessary, but they're certainly not going to sit down and tell us. We have a letter. We're making available to you the complaints that we have filed so that you can drill down. It's got links upon links, headlines, endnotes, charts, the facts and figures that paint this very, very sordid and disturbing set of facts and the impact. And as you heard from Chairman Pitts, there's research underway that will be pulled together very shortly, and we'll continue to document the damage in the community, the needs of the community. And we are calling today on Wellstar to respond. You don't walk away, get yourself in the budget for a hospital over in Columbia County and turn your backs. I want to thank folks who have not spoken at this point, but the chair of our Fulton County delegation in the Senate, Sonia Halpern, longtime advocate for health and equality, Senator Donzella James, who represents many citizens and communities in this area. From the DeKalb County, the great state of DeKalb, State Representative Mary Margaret Oliver.
$27 million.
Yes. Add that.
I'm a native of Georgia. The great Georgia Baptist Hospital was part of my life growing up. I say to all the Baptists of Georgia, please pay attention to this disaster. Under the leadership of Mike Thurman, DeKalb County had to appropriate immediately, almost immediately, $27 million additional dollars from my constituents' taxes over to Grady in order to help anticipate the disaster that this represents for DeKalb County. We will be spending much more money if this disaster is allowed to continue. I believe redlining of health care is legally unconstitutional. We'll find out from these very well-crafted, very evidence-supported complaints. But I will say this to all the political leaders: if it's not illegal, it should be. Thank you very much.
Thank you. And we have the mayor of East Point was unable to join us today with a schedule conflict. We have the council member Karen Renee, who has joined us, and of course that city is heavily impacted, guided by caring elected officials who would have done everything within their power to work with Wellstar to find solutions. When you get the complaint, and how do they get the complaint, Emily?
I'll send it to him, to the media credentials.
Great, and that has the links. That'll be digital so that you can follow the links and pursue this further. And again, the attachment 3, which shows the diversity of the areas impacted. And I will also. Is there anyone else that's joined us? Many legislators represent citizens in this area. The concerns are very high, and we have the documentation. I'll call your attention to a letter that the Regional Advisory Board sent to the Wellstar Corporation. It's contained into the complaint, but it says that, and this is to the chair of the board of the Wellstar Health System. For the last 4 years, we've listened patiently to ideas to invest in the 2 hospitals and witnessed a parade of revolving Atlanta Medical Center CEOs and Wellstar corporate headquarters leaders providing the AMC Regional Health Board with a modicum of vague plans to strengthen the capacity of the AMC downtown and East Point locations to better serve these communities. In December 2020, we were introduced to the 3rd interim CEO since 2019. We're deeply disappointed Wellstar has been unable to utilize its extensive experience and resources to meet the unrealized potential of these hospitals and the community they serve. So they're requesting, and this is a board that has no power. It is merely advisory. There's one board for Wellstar. It's out there in Marietta. They've been doing suburban hospital service. That's their sweet spot. But apparently that didn't work for them downtown. We regret that they chose to leave in the way that they chose. We regret that they are unashamedly over in Augusta negotiating contracts. And we're going to go ahead and move to questions because there's several of us that are here, and I know everybody's got commitments. So, yes, Ms. Grapevine.
Yes, thanks. First of all, how do you hope and realistically how do you think this could impact the Augusta Youth Partnership, just given the reality of timelines? And secondly, how common are these kinds of complaints? Is Atlanta, or are you all kind of going out on a limb here, or have you seen this done in other jurisdictions?
I'm not apprised of the corporate shenanigans over there in Augusta. They're not sharing that with us. They didn't share what they were doing over here. They certainly aren't sharing what they are doing in Augusta. But I've been given to understand by third parties that the negotiations are moving apace, and that the $1.7 million or so, give or take, some change that's going into improving the data system over there as part of what Wellstar wants to have happen as they negotiate their deal. So we might be well advised to ask Wellstar to go on the record about how those negotiations are going over there. But in filing these complaints, it's complaints about violations of the Civil Rights Act are not uncommon. This is, I think, a very glaring one with plenty of evidence. And our hope and our intention in filing these is that there will be a thorough investigation by the Office for Civil Rights of the U.S. Health and Human Services Department, that there will be a thorough investigation of this complaint by the Internal Revenue Service, that on the face of things they have failed to comply with the requirements. And Wellstar needs to come to the table with the patient community, with the doctors, the other healthcare providers, and the public officials that are prepared to be prepared to discuss and tangibly contribute to repairing the damage that their action has caused. Yes?
Senator, the IRS, I suppose, could conceivably revoke or suspend.
That's right. That's right.
What could Health and Human Services do? And has there been any thought of also conveying this to the DOJ?
I really can't speak about the DOJ, but they are certainly can and I believe will launch the investigation and make a determination on whether there's been a violation of Title VI. Were you? Oh, okay. I mean.
Senator, my name is Kenya Hunter. I'm from Capitol B, Atlanta. OCR complaints often take years, sometimes a decade to resolve. So I'm wondering what's being done on the ground now to get people in South Fulton the health care that they need now, considering the low life expectancy that's there compared to North Fulton. Like, what is being done by lawmakers on the ground today?
Maybe you want me to answer?
Yeah, go ahead.
Okay, from here I can answer. I talk loud. But we first got together different people in South Fulton areas of East Point, College Park, Hapeville, the city of South Fulton, et cetera, Chattahoochee Hills even, to see if we could do something. So then we saw that we might have to form a hospital authority. We were having trouble with Wellstar not wanting to reopen, so we knew we were gonna have to do something to take care of our many citizens who do get sick. And so as a result, many doctors, even in Morehouse School of Medicine, I've met with so many people who are trying to get it together. So we're looking at a hospital authority with East Point. We found out that the counties, we were having problems with the COEs and certificates of need, and the counties and the cities can pull their own COD without going through legislation or anything else. So we're encouraging everyone to come together now so that we can have a real resolution. I know the city of South Fulton, the new city of South Fulton, was looking at hospital on Camp Creek Parkway in that area. And the Catholic Social Services used to have Holy Family Hospital 1,000,000 years ago off of Ferry Road, and they still own a lot of land and property at the Blessed Sacrament, something off of Butler Road in Camp Creek. So they're in negotiation too with these other doctors. Many of them are minority doctors who were adversely affected by the closing of these hospitals. And so they want to come together and try to do something. So we're not waiting until Wellstar decides, oh, we're going to open it. We know that we need to do something ourselves. So we are working on that too. But the complaints are valid, and they do need to do something with the Justice Department or somebody, because this was illegal, and they should not have changed it. From 2020, from COVID to post-COVID, they still had so many patients standing in line for hours or overnight almost in both hospitals. So it was no reason for them to say, we don't have the patients, we don't have. Right. It's all about the almighty dollar. And we realize that, and we're taking it into our own hands. So we're not sitting around twiddling our thumbs as elected officials. We're trying to find a real solution. Thank you.
Thank you.
And it's anticipated, those in charge of a major health corporation who are seeking to cut deals across the state for additional facilities would be well served to take quite seriously a charge of violation of Title VI of the Civil Rights Act, and not wait for some long winding through a process, but actually step forward and show good faith and be a part with other stakeholders of repairing the damage.
Senator, I got to follow up to that, because right now there's a fresh debate over certificate of need legislation. Should lawmakers take into account Wellstar's decisions as they debate new rules for opening new hospitals?
I'm sure that'll be on the table and be part of what's considered, and it's been brought up in some committee hearings already. Thank
Senator,
you. Yeah.
People with the AU health system that felt that they were in a poor competitive position and didn't have any partners and might be at a long-term disadvantage.
People in which system?
Who run the Augusta University Health System.
Oh, okay, thank you.
If you were to succeed in fixing it so that Wellstar could not take them over, are you worried about leaving a state asset in a poor position over there?
I'm not leaving anything anywhere over in Augusta. I understand your question, but that would inform the decision that are being made. Without a doubt, they have unfinished business here in Atlanta.
Should AU suffer as well because the people who were served by AMC were suffering?
I'm in no way throwing shade on Augusta Medical. And any implications, any fallout, is the responsibility I lay at the feet of Wellstar. They are they took the actions. They failed to consult. They ignored advice from their own advisory boards of citizens and healthcare providers, and they shut down 16 medical practices right there in the shadow of these two hospitals without a fare thee well. And we're going to hold them accountable. And these federal agencies are going to be looking into this, as we have outlined. The chairman has had to leave. So I urge your attention to the press folks. Emily Leonard can get to you the complaints, the actual complaints themselves, with all the end notes and the links, and we'll be happy to continue this conversation. Thank you all so very much for your